Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Functional Independence Measure assesses a patient's level of disability in performing daily activities. It evaluates motor functions such as self-care, sphincter control, mobility, and locomotion. The instrument also measures cognitive functions, including communication and social cognition. Its main purpose is to determine the degree of assistance a patient requires to carry out essential tasks following conditions like stroke, spinal cord injury, or traumatic brain injury. The tool supports clinical decision-making by tracking functional progress and guiding rehabilitation planning. The Functional Independence Measure is indicated primarily for patients recovering from acquired brain injuries, including stroke and traumatic brain injury. It is commonly utilized in rehabilitation settings to assess patients with neurological impairments affecting motor and cognitive functions. The tool reliably measures the level of a patient's disability and tracks progress during inpatient rehabilitation. It is also applicable for older adults with functional decline due to chronic medical conditions. The measure's emphasis on self-care, mobility, and cognitive skills makes it useful for multidisciplinary teams aiming to plan treatment goals and discharge planning. The Functional Independence Measure consists of 18 items assessing physical and cognitive disability. First, the assessor evaluates each item individually, covering 6 areas: self-care, sphincter control, mobility, locomotion, communication, and social cognition. Each item is rated on a 7-point ordinal scale, where 1 signifies total assistance and 7 indicates complete independence. The assessment involves direct observation or reliable report of the patient's performance in daily activities. Scores for all items are summed to produce a total score ranging from 18 to 126. Higher total scores represent greater functional independence. Reference values vary by clinical population and setting, but generally, scores below 60 suggest significant dependence, while scores above 100 are associated with minimal assistance needs. Changes in score should be interpreted relative to baseline functioning and clinical context, with a difference of 2 or more points in individual items often considered clinically meaningful. Sensitivity refers to the ability of the Functional Independence Measure to correctly identify patients who have a specific level of functional impairment. Specificity is the measure's ability to correctly identify patients who do not have the impairment. Studies assessing the Functional Independence Measure report sensitivity values ranging from 85% to 95% when detecting functional dependence in stroke patients. Specificity values are generally lower, ranging from 70% to 85%, indicating some false positives in identifying independence. For example, a sensitivity of 90% implies that 90% of patients who are genuinely dependent are correctly classified by the measure. A specificity of 75% means that 75% of patients who are independent are accurately identified, but 25% may be incorrectly labeled as dependent. These metrics highlight the Functional Independence Measure's strength in detecting impairment while indicating a moderate rate of false classification in independence status in clinical use. The Functional Independence Measure test was developed in the late 1980s through a collaborative effort led by Granger and colleagues at the University of Buffalo as part of a nationwide initiative to standardize the assessment of disability and functional status in rehabilitation settings. Validation studies conducted in subsequent years have demonstrated strong reliability and construct validity across diverse patient populations, including stroke, traumatic brain injury, and spinal cord injury. Initial research showed that inter-rater reliability coefficients consistently exceeded 0.9, indicating high agreement among clinicians administering the test. Further analyses confirmed the measure's sensitivity to clinically meaningful changes in functional status over time, supporting its utility for tracking rehabilitation outcomes. Factor analyses have supported the instrument's two-domain structure, addressing motor and cognitive function, correlating strongly with other established measures of physical independence and cognitive ability. Furthermore, large-scale studies utilizing nationally aggregated data established predictive validity, demonstrating that scores on the Functional Independence Measure test can effectively forecast length of stay and discharge disposition in rehabilitation hospitals. These findings have been published in multiple peer-reviewed journals and have contributed to the widespread adoption of the test in clinical practice and research. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.